Good day, everyone. Today we'll be discussing dietary guidelines, which is a very important foundation not just in nutrition but also in physical therapy practice. As future physical therapists, you might think nutrition is outside your scope, but in reality, it plays a major role in recovery, healing, and overall patient outcomes. For example, wound healing, muscle repair, and even inflammation are directly affected by what our patients eat. So, this lecture is designed to give you a practical understanding of how diet influences health, not just theoretically, but in ways that you can actually apply when managing patients. We'll go through general dietary principles first, then move into nutrition therapy for common conditions like obesity, diabetes, osteoarthritis, and gout. By the end of this lecture, I want you to be able to 1. Understand what a healthy diet really means, 2. Identify poor dietary patterns in patients, 3. And relate nutrition to clinical conditions you will encounter. So let's start with the basics. What exactly are dietary guidelines? Dietary guidelines are essentially evidence-based recommendations designed to help individuals achieve a healthy and nutritionally adequate diet. Now take note, these guidelines are not just for dietitians. They are also for healthcare professionals like us because we are part of the patient's overall care team. The goal here is very important: promote health and prevent disease. So this is more on prevention, not treatment. That's why the slide clearly says, it is not intended to treat chronic diseases. That will come later under nutrition therapy. Another key concept here is that dietary guidelines, 1. Recognize that many chronic diseases like diabetes, hypertension, and obesity are diet-related. 2. Focus on overall dietary patterns, not just individual foods. And 3. Apply to every stage of life, from infancy to old age. This is very important clinically. For example, a patient with osteoarthritis doesn't just need exercise, you also consider their diet across their lifespan. So instead of saying avoid this food or eat this food, we look at the big picture, what they eat daily, consistently. That brings us to the core message of the guidelines: make every bite count. This slide summarizes the 4 key principles of dietary guidelines. Let's break it down one by one. First, follow a healthy dietary pattern at every stage of life. Meaning, nutrition is not temporary. It's lifelong. From infancy to elderly, diet affects growth, function, and disease risk. Second, customize and enjoy nutrient-dense foods. This is very important. Diet is not one size fits all. We consider culture, e.g., Filipino diet, budget, and personal preferences. Because if a diet is not realistic, patients won't follow it. Third, focus on nutrient-dense foods. This means foods that give more nutrients per calorie. Example, fruits versus candy, vegetables versus processed snacks. Fourth, limit sugar, saturated fat, sodium, and alcohol. These are the major contributors to chronic diseases. So the idea is not restriction but balance. As clinicians, instead of telling patients don't eat this, it's better to say, let's improve your overall eating pattern. That's a more sustainable approach. Now let's apply this principle starting from the earliest stage of life. This slide focuses on early life nutrition, which is actually very critical. From birth to 6 months, the recommendation is exclusive breastfeeding. Why? Provides complete nutrition, supports immunity. It reduces risk of infections and chronic disease later in life. Vitamin D supplementation is also recommended because breast milk alone may not provide enough. Breastfeeding is not possible. Iron-fortified formula is used. Now at around 6 months, we introduce complementary feeding. Important points here: start nutrient-dense foods. Include iron and zinc-rich foods because deficiencies are common. Introduce allergenic foods early. This actually helps prevent allergies. And very importantly, encourage variety of foods from all groups. Why? Because early exposure shapes long-term eating habits. So even at this stage, we are already building the patient's future dietary pattern. This is something to remember, especially when educating parents. Now, moving on to the rest of the lifespan. From 1-year-old up to older adulthood, the goal becomes more comprehensive. First, meet nutrient needs. This means ensuring adequate intake of vitamins, minerals, protein, and energy. Second, achieve and maintain a healthy body weight. This is very relevant in physical therapy because obesity affects mobility, while being underweight affects strength and recovery. Third, reduce the risk of chronic diseases such as diabetes, hypertension, and cardiovascular disease. So, diet is not just about eating, it is about long-term health outcomes. As physical therapists, you will encounter patients with conditions such as stroke, osteoarthritis, and diabetes. And all of these conditions are influenced by diet. So even if you are not prescribing a diet, you should still be able to recognize unhealthy patterns, reinforce basic dietary advice, and refer when necessary. Always remember this: exercise plus nutrition leads to better patient outcomes. Now that we understand the lifespan approach, let us go deeper into how diet can be personalized. Now, let us talk about personalization in nutrition. One of the most important ideas in dietary guidelines is this: a healthy diet should not feel restrictive or unrealistic. Eating should be enjoyable, should be sustainable, and most importantly, it should fit the individual. A healthy dietary pattern can be followed from early life to older adulthood, but it must be adapted based on personal preferences, cultural traditions, and even budget. For example, in our setting, rice is a staple food. So instead of removing rice completely, we guide patients toward portion control or choosing better combinations with vegetables and protein. Another key idea here is inclusivity. A healthy dietary pattern should benefit all individuals, regardless of age, ethnicity, or current health status. This means we do not create perfect diets. We create realistic, achievable patterns. Now let us talk about nutrient-dense foods. Nutrient-dense foods are those that provide high amounts of vitamins and minerals relative to their calorie content. Examples include vegetables, fruits, whole grains, lean proteins, and dairy. These foods should make up the majority of what a person eats daily. The major food groups mentioned here include vegetables, fruits, grains, dairy, and protein-rich foods. Each group provides specific nutrients that the body needs. So instead of focusing on eliminating foods, we emphasize adding more nutrient-dense choices. This approach helps patients feel less restricted and more empowered. As healthcare providers, our role is to meet patients where they are. We guide them step by step, not overwhelm them with drastic changes. So remember, a good diet is not just healthy, it is also practical, enjoyable, and sustainable. Now, let us define what we mean by a dietary pattern. A dietary pattern refers to the totality of what a person habitually eats and drinks. It is not just one meal or one food choice. It is the overall pattern over time. This is very important, because the body responds not to single foods but to consistent habits. Another key concept here is synergy. Components of a diet work together. For example, fiber, vitamins, and antioxidants from different foods interact to improve health. This is why focusing on a single nutrient like protein or carbohydrates is not enough. We must look at the whole diet. Now, let us go to the daily goals provided in the slide. These are general recommendations for a standard diet. Grains, about 6 servings per day, with at least half coming from whole grains. Vegetables, about 2.5 cups. Fruits, about 2 cups. Dairy, about 3 cups. Protein-rich foods, about 5.5 ounces. These values are not strict rules but guidelines. They help us visualize a balanced plate. For example, if a patient is eating mostly rice and meat but very little vegetables, we can identify the imbalance. As physical therapists, this is useful when doing patient education. Even without detailed diet planning, you can ask simple questions like, are you eating vegetables daily? Do you include fruits in your meals? These small assessments already give insight into their dietary pattern. So remember, it is not about perfection. It is about balance, consistency, and long-term habits. Let us now focus on vegetables. Vegetables are one of the most important components of a healthy diet. But not all vegetables are the same. They are classified into different groups based on their nutrient content. First, dark green vegetables. These include spinach, broccoli, and leafy greens. They are rich in iron, calcium, and vitamins. Second, red and orange vegetables. Examples include carrots, squash, and tomatoes. These are high in vitamin A and antioxidants. Third, beans, peas, and lentils. These are unique because they provide both carbohydrates and protein. They are also high in fiber. Fourth, starchy vegetables. Examples include potatoes, corn, and cassava. These provide energy but should be balanced with other types. And finally, other vegetables. These include a wide variety of commonly consumed vegetables. Key message here is variety. Each type of vegetable provides different nutrients. So if a patient only eats one type, for example, only potatoes, they are missing other essential nutrients. Another practical strategy is increasing vegetable intake in mixed dishes. For example, adding more vegetables to soups, stews, or rice meals, or reducing the portion of meat and increasing vegetables as side dishes. As clinicians, we should encourage patients to gradually increase vegetable intake. Not force, but guide, because vegetables play a major role in preventing chronic diseases and improving overall health. Now, let us discuss fruits and grains. Starting with fruits. Fruits provide essential vitamins, minerals, and fiber. They are naturally sweet, making them a healthier alternative to processed desserts. However, there is an important distinction. Whole fruits are preferred over fruit juices. Why? Because whole fruits contain fiber, which slows sugar absorption. Juices, on the other hand, can lead to rapid increases in blood sugar. So when advising patients, encourage whole fruits rather than juice. Now let us move to grains. Grains are a major source of energy. They are classified into two types, whole grains and refined grains. Whole grains include brown rice, oats, and whole wheat. They contain all parts of the grain, bran, germ, and endosperm. This means they are rich in fiber, vitamins, and minerals. Refined grains, on the other hand, have been processed. They lose some of their nutrients during processing. Examples include white rice and white bread. Now, refined grains are not completely bad, but the recommendation is that at least half of grain intake should be whole grains. This improves digestion, helps control blood sugar, and reduces disease risk. So the key takeaway here is balance. Encourage more whole fruits and more whole grains. These simple changes can significantly improve a patient's overall diet. Let us move on to dairy and protein foods. First, dairy. Dairy products include milk, yogurt, and cheese. They are important sources of calcium, vitamin D, and protein. The recommendation is to choose low-fat or fat-free options when possible. For individuals who are lactose intolerant, alternatives such as fortified soy milk can be used. The goal is still the same, to meet calcium and nutrient needs. Now let us discuss protein foods. Protein is essential for muscle repair, tissue healing, and overall body function. This is especially important in physical therapy. Protein sources include meats, poultry, eggs, seafood, beans, lentils, nuts, and seeds. Now, not all protein sources are equal. Lean meats and plant-based proteins are generally healthier choices. Patients should be encouraged to limit processed meats like hot dogs, sausages, and bacon. Instead, they can choose fish, beans, or lean cuts of meat. Seafood is also important because it contains healthy fats, particularly omega-3 fatty acids. Another important group is nuts and seeds. These provide healthy fats and additional nutrients. So the overall message is this: encourage variety in protein sources. Choose healthier options. And balance intake with other food groups. As physical therapists, remember, adequate protein intake supports recovery, muscle strength, and rehabilitation outcomes. This slide focuses on one of the most practical aspects of dietary guidelines, meeting food group needs using nutrient-dense foods while staying within calorie limits. Let us go through each food group briefly. First, vegetables. We should include vegetables of all types: dark green, red, and orange, legumes, and starchy vegetables. A practical strategy is to increase vegetables in mixed dishes. For example, adding more vegetables to soups, stir-fry, or rice meals. Another approach is to reduce the portion of the main dish and allow more vegetables as side dishes. Second, fruits. Focus on whole fruits. Desserts like fruit pies may contain fruit, but they are not considered nutrient-dense because of added sugar and fat. Third, grains. At least half of grain intake should be whole grains. Whole grains provide fiber and essential nutrients that refined grains lack. Fourth, dairy. Choose fat-free or low-fat milk, yogurt, or cheese. For patients with lactose intolerance, lactose-free products or fortified alternatives can be used. Fifth, protein foods. Encourage lean meats, poultry, seafood, beans, lentils, nuts, and seeds. A key recommendation is to replace processed or high-fat meats, such as bacon or sausages, with healthier options like fish or plant-based proteins. Finally, oils. Use vegetable oils and natural sources of fats like nuts and seafood. Avoid or limit solid fats such as butter, lard, and shortening. And remember, the general recommendation is about 6 teaspoons of oil per day. So overall, the goal is simple: choose foods that give more nutrients and avoid exceeding your daily calorie needs. This balance is essential for maintaining health and preventing disease. Now, let us focus on an equally important concept: not just what to eat more of, but what to limit. This slide highlights 4 key components that we need to control in the diet: added sugars, saturated fat, sodium, and alcohol. These are the major contributors to many chronic diseases. Now, let us look at the visual in the center of the slide. This is called the 85 to 15 guide. It shows that about 85% of your daily calorie intake should come from nutrient-dense foods. These include vegetables, fruits, grains, dairy, and protein sources. In other words, most of what you eat should nourish your body. Now, the remaining 15% can come from other sources. This includes foods with added sugars, saturated fats, and less nutrient-dense options. But take note, this does not mean unlimited intake. It simply means there is room for flexibility. This approach is important because it promotes balance, not restriction. Patients are more likely to follow dietary advice if they know they are not being completely deprived. Now, let us briefly discuss each component. First, added sugars. These are commonly found in soft drinks, desserts, candies, and sweetened beverages. Excess intake of sugar can lead to weight gain, insulin resistance, and eventually diabetes. Second, saturated fat. These are found in fatty meats, butter, and processed foods. High intake increases the risk of cardiovascular disease. So we encourage replacing these with healthier fats, such as those from fish, nuts, and plant oils. Third, sodium. Too much sodium is strongly linked to high blood pressure, and hypertension is a major risk factor for stroke and heart disease. So reducing salt intake and avoiding processed foods can significantly improve health outcomes. Finally, alcohol. Alcohol should always be taken in moderation. Excessive intake can damage the liver, increase blood pressure, and raise the risk of cancer. Now, as future physical therapists, this concept is very important in patient education. Many patients think they need to completely eliminate unhealthy foods, but that is not always realistic. Instead, we teach balance. We guide them to focus on the 85% and be mindful of the 15%. So the key takeaway here is this: build your diet around nutrient-dense foods and limit those that increase disease risk, because small daily choices have a big impact on long-term health. Now we move to what should be limited in the diet. This slide highlights 4 major components that contribute to chronic disease: added sugars, saturated fat, sodium, and alcohol. Let us start with added sugars. These are sugars added during processing or preparation. Examples include soft drinks, candies, pastries, and sweetened beverages. The recommendation is to limit added sugars to less than 10% of total daily calories. Why is this important? 'Cause excess sugar intake is linked to obesity, diabetes, and cardiovascular disease. Next, saturated fat. These are commonly found in butter, fatty meats, and processed foods. High intake increases the risk of heart disease. So we encourage replacing saturated fats with healthier fats, such as those found in vegetable oils, nuts, and fish. Third, sodium. High sodium intake is strongly associated with hypertension. The recommended limit is about 2,300 milligrams per day. A simple strategy is to reduce processed foods and use herbs and spices instead of salt. Finally, alcohol. Alcohol should be limited to moderate intake. That means up to 2 drinks per day for men and 1 drink per day for women. Excess alcohol intake increases the risk of cancer, liver disease, and cardiovascular problems. So the key message here is moderation. We do not need to completely eliminate these, but we must control intake. As clinicians, we should help patients become aware of these hidden risks in their diet. Now, let us look at a practical example of how a healthy diet can be applied in one full day. This slide shows a sample daily food plan, including breakfast, lunch, dinner, and snacks. The goal here is not to memorize the exact foods, but to understand how balance is achieved throughout the day. Let us start with breakfast. Breakfast includes overnight oats, yogurt, banana, nuts, and coffee. Notice that this meal contains carbohydrates, protein, and healthy fats. Carbohydrates provide energy, protein supports muscle function, and fats help with satiety. This combination helps sustain energy levels throughout the morning. Now, moving to lunch. Lunch includes a chicken burrito bowl with vegetables, grains, and protein. Can we see balance? There is protein from chicken, fiber from vegetables, and carbohydrates from grains. This kind of meal helps maintain stable blood sugar levels. Now, let us look at dinner. Dinner includes roasted tilapia, vegetables, and pasta. Here, we again see a combination of protein, carbohydrates, and micronutrients. Fish is particularly beneficial because it contains healthy fats such as omega-3. Vegetables provide vitamins and fiber, while pasta provides energy. Now, snacks. Snacks include popcorn and yogurt with fruit. Healthy snacks are important because they prevent excessive hunger and reduce the tendency to overeat during main meals. Now, take note of the total daily calories. This plan is approximately 2,000 calories per day. This is a general reference value, but individual needs may vary depending on age, activity level, and health status. So the key message of this slide is this: a healthy diet is not about a single meal, it is about balance across the entire day. Each meal contributes to the overall dietary pattern. As healthcare providers, we can use examples like this to help patients visualize what a balanced diet looks like. Because when patients can see it, they are more likely to follow it. Now, we move into a more clinical topic: nutrition therapy. So far, we have discussed general dietary guidelines. These are mainly for health promotion and disease prevention. But nutrition therapy is different. Nutrition therapy refers to the use of specific nutrition interventions to manage illness, injury, or medical conditions. This is more targeted and more individualized. It is based on the patient's condition, laboratory findings, and overall health status. There are 2 main phases in nutrition therapy. First, nutrition assessment. This involves evaluating the patient's nutritional status. We look at indicators such as body weight, body composition, laboratory results, and physical signs. This helps us understand whether the patient is undernourished, overnourished, or has specific deficiencies. Second, nutrition intervention or therapy. This includes the actual treatment strategies. Examples include diet modification, counseling, supplementation, and nutritional support. For example, a patient with diabetes may need carbohydrate control, while a patient with kidney disease may need protein restriction. So the intervention depends on the condition. As physical therapists, you may not prescribe these interventions directly. However, understanding them is essential, because nutrition plays a major role in healing, recovery, and rehabilitation outcomes. So always think of nutrition therapy as part of a multidisciplinary approach, working together with dietitians and physicians. This ensures that the patient receives comprehensive care. Now, let us talk about systems review, specifically focusing on nutrition. In clinical practice, systems review includes assessing the patient's nutritional habits and practices. This is important because diet directly affects recovery and overall health. The slide presents a nutritional screening tool. This tool helps us evaluate the patient's dietary patterns. It includes questions related to intake of vegetables, fruits, whole grains, fats, protein, and other components. Now, why is this important? Because it helps us identify whether the patient's diet is healthy or not. For example, if a patient has low vegetable intake, high sugar intake, and frequent consumption of processed foods, we can already identify areas for improvement. The screening also helps determine whether further assessment is needed. For instance, if we suspect poor nutrition, we may need to assess body mass index or basal metabolic rate. Another important point is classification. The responses can indicate whether intake is high, moderate, or low. This allows us to quickly identify patterns. For example, high vegetable intake is good, but high intake of sweets or salt is a concern. As physical therapists, this tool is very useful. Even without being nutrition specialists, we can screen patients and identify potential issues. Then we can provide basic advice or refer them to a dietitian if needed. So always remember, assessment is the first step in intervention. You cannot improve what you do not assess. Let us discuss the goals of therapeutic diet modification. When we modify a patient's diet, it is not random. It is guided by specific goals. First, maintain or restore good nutrition. This means ensuring that the patient receives adequate nutrients, especially during illness or recovery. Second, provide rest to the affected organ or system. For example, in gastrointestinal conditions, certain foods may be restricted to reduce stress on the digestive system. Third, correct nutritional deficiencies. If a patient lacks certain vitamins or minerals, the diet must be adjusted to address these deficiencies. Fourth, achieve appropriate changes in body weight. This may involve weight loss or weight gain depending on the patient's condition. For example, an obese patient may need caloric restriction, while an undernourished patient may need increased intake. Fifth, adjust food intake based on the patient's condition. This includes considering the digestive capacity, the ability to metabolize nutrients, and the need to prevent disease symptoms. It may also involve eliminating certain foods that trigger symptoms. So overall, therapeutic diet modification is highly individualized. It is based on the patient's needs, condition, and goals. As physical therapists, understanding these principles helps us support the patient's recovery. Because nutrition is not separate from treatment, it is part of the treatment. Now, before we apply nutrition therapy, we need to understand the key considerations. Nutrition management is not one size fits all. It must be individualized for each patient. First, normal nutrient requirements. We begin by identifying the recommended nutrient intake for a healthy individual. This serves as our baseline. From there, we adjust depending on the patient's condition. Second, the pathophysiology of the disease. We must understand how the disease affects the body. For example, in diabetes, there is a problem with insulin and blood sugar regulation. So dietary modifications will focus on controlling glucose levels. Third, the duration of the disease. Is the condition acute or chronic? Acute conditions may require short-term dietary changes, while chronic diseases require long-term management. Fourth, the patient's previous nutritional status. Was the patient well-nourished, undernourished, or overweight? This influences how aggressive or conservative our intervention should be. Fifth, socioeconomic and cultural factors. Can the patient afford the recommended foods? Do their cultural practices influence their diet? These are very important because unrealistic recommendations will not be followed. Sixth, tolerance to food. Some patients may have allergies, intolerances, or difficulty digesting certain foods, so we must adjust accordingly. Finally, specific dietary factors. This includes things like sodium restriction, fluid restriction, or macronutrient adjustments. So always remember, effective nutrition therapy is personalized. That considers not just the disease but the whole patient. Now, let us look at the conditions where nutrition therapy is commonly applied. This slide highlights 4 major conditions: obesity, diabetes mellitus, osteoarthritis, and gout. These are very relevant in clinical practice. You will encounter these conditions frequently as physical therapists. Now, what do these conditions have in common? They are all influenced by lifestyle, particularly diet. For example, obesity is directly related to caloric imbalance. Diabetes is strongly affected by carbohydrate intake. Osteoarthritis is influenced by body weight and inflammation. And gout is linked to purine metabolism and dietary choices. So nutrition plays both a preventive and therapeutic role. Now, why is this important for physical therapists? Because these conditions affect movement, function, and quality of life. For example, an obese patient may have difficulty with mobility and exercise. A diabetic patient may have poor wound healing or neuropathy. The patient with osteoarthritis may have joint pain aggravated by excess weight. So even though we focus on physical rehabilitation, we must also consider nutritional factors. This allows us to provide more holistic care. Let us start with obesity. Obesity is defined as abnormal or excessive fat accumulation that presents a risk to health. Now, how do we classify obesity? The most commonly used method is body mass index, or BMI. BMI is calculated as weight divided by height squared. It is simple, widely used, and very useful for screening large populations. However, it is important to remember, BMI does not directly measure body fat. So while it is useful, it is not perfect. Now, let us look at the classification of obesity based on BMI, as shown in the table on the slide. First, underweight. This is a BMI of less than 18.5. Second, normal or healthy weight. This ranges from 18.5 to 24.9. Third, overweight, also called pre-obese. This is from 25 to 29.9. Now we move into obesity categories. Class 1 obesity is a BMI of 30 to 34.9. Class 2 obesity is 35 to 39.9. And Class 3 obesity, also known as morbid obesity, is a BMI of 40 or higher. Now, why is this classification important? Because as BMI increases, the risk for diseases such as diabetes, hypertension, and cardiovascular disease also increases. So BMI helps us quickly assess the level of risk. But again, BMI has limitations. It does not tell us where fat is located in the body. And this is where waist circumference becomes very important. Waist circumference measures abdominal fat, or what we call central obesity. And central obesity is more strongly associated with metabolic complications. Now, let us look at the classification based on waist circumference, as shown in the second table. For men, a waist circumference of 94 to 102 centimeters indicates increased risk. If it is more than 102 centimeters, this indicates a substantially increased risk. For women, a waist circumference of 80 to 88 centimeters indicates increased risk. And more than 88 centimeters indicates a substantially increased risk. Now, why is abdominal fat more dangerous? Because it is closely linked to insulin resistance, inflammation, and cardiovascular disease. So a person may have a normal BMI, but if they have a high waist circumference, they are still at high risk. This is very important in clinical practice, because if we rely on BMI alone, we might miss patients who are actually at risk. So ideally, we use both BMI and waist circumference together. Now, let us bring this back to physical therapy practice. As physical therapists, we often see patients with mobility limitations, joint pain, and reduced endurance. Many of these are related to excess body weight. So, understanding obesity classification helps us in several ways. First, it helps us identify at risk patients. Second, it helps us tailor exercise programs safely. And third, it allows us to educate patients about the importance of weight management. Now, one final point: obesity is not just a cosmetic issue, it is a chronic medical condition with serious health consequences. So, early identification and proper classification are essential for effective management. Because once we understand the level of risk, we can begin appropriate intervention. Now, let us explore the causes and consequences of obesity. First, the causes. The most common cause is an imbalance between caloric intake and energy expenditure. In simple terms, eating more calories than the body uses. However, obesity is not always that simple. There are also metabolic and medical conditions involved. Examples include Cushing syndrome, hypothyroidism, and genetic conditions such as Prader-Willi syndrome. So obesity is multifactorial. Now let us look at the consequences. Obesity significantly increases the risk of death. It also reduces life expectancy, especially in severe cases. Now let us break down the complications. Metabolic complications include type 2 diabetes, hypertension, stroke, and polycystic ovary syndrome. Physical complications include osteoarthritis, low back pain, decreased mobility, and skin problems. These are highly relevant in physical therapy because they directly affect movement and function. There are also psychosocial effects. These include depression, low self-esteem, and impaired social relationships. So obesity affects not just the body but also mental and social well-being. This highlights the importance of a comprehensive approach to management. Now, let us discuss dietary management of obesity. There are different approaches, but two of the most commonly used are low-fat diets and low-carbohydrate diets. Let us start with the low-fat diet. This approach focuses on reducing fat intake, particularly saturated fats found in fried foods, fatty meats, butter, and processed snacks. Instead, patients are encouraged to eat foods that are lower in fat, such as vegetables, fruits, whole grains, and lean protein sources. For example, instead of fried chicken, a patient may choose grilled or baked chicken. Instead of using butter, they may use small amounts of vegetable oil. Instead of fast food, they may shift to home-cooked meals with more vegetables. Now, this type of diet is usually used for gradual weight loss, about 0.5 to 1 kilogram per week. And that is actually ideal, because slower weight loss is more sustainable and less likely to result in rebound weight gain. Another important feature of a low-fat diet is that it promotes long-term behavioral change. It is not just about reducing fat, it is about improving overall eating habits. So this approach is best for patients who prefer a steady, structured, and sustainable plan. Now let us move to the low-carbohydrate diet. This approach focuses on reducing carbohydrate intake, especially refined carbohydrates like white rice, bread, pasta, and sugary foods. Initially, carbohydrate intake may be very low, sometimes less than 20 grams per day. Then it is gradually increased, depending on the patient's response. In this diet, protein and fat intake are less restricted. So patients may eat more meat, eggs, cheese, and healthy fats. For example, instead of rice or bread, a patient may eat eggs and vegetables for breakfast. Instead of sugary snacks, they may eat nuts or cheese. Instead of soft drinks, they may switch to water or unsweetened beverages. Now, one reason why low-carb diets can lead to faster weight loss is because reducing carbohydrates lowers insulin levels, which promotes fat breakdown. Also, patients tend to feel full faster because protein and fat increase satiety. However, there are some considerations. This diet may be difficult to maintain long-term, especially in cultures where carbohydrates are staple foods like rice. Also, if not properly guided, patients may consume too much unhealthy fat. So education is very important. Now let us answer the common question, which diet is better? The answer is, it depends on the patient. There is no single best diet for everyone. For example, a patient who enjoys rice-based meals may struggle with a strict low-carb diet, so a moderate, balanced approach may be better. On the other hand, a patient who prefers protein-rich foods may do well on a low-carbohydrate diet. So the key factor is adherence. Can the patient follow the diet consistently? Because even the best diet will fail if the patient cannot maintain it. As clinicians, we also consider the patient's health condition. For example, a patient with cardiovascular disease may benefit more from a low-fat diet. A patient with insulin resistance or diabetes may respond well to a controlled carbohydrate diet. So our role is not to prescribe a perfect diet, but to guide patients toward a plan that is realistic, sustainable, and appropriate for their condition. Now, let me emphasize one important point. Weight loss is not just about diet alone. It must be combined with physical activity, behavioral changes, and long-term lifestyle modification. Because in the end, long-term success is more important than short-term results. So always remember, the best diet is the one the patient can follow consistently, safely, and sustainably. Now, let us continue with additional dietary strategies for managing obesity. First approach is calorie counting. Calorie counting is based on a simple principle. Weight loss occurs when calorie intake is less than calorie expenditure. In other words, the patient must consume fewer calories than the body uses. Now, how is this applied in practice? Patients are taught to estimate or track the calories in the food they eat. For example, a cup of rice, a piece of chicken, or a sugary drink all have corresponding calorie values. By becoming aware of these values, patients can make better food choices. For instance, instead of drinking a 300-calorie soft drink, they may switch to water, which has 0 calories. Or instead of eating fried food, they may choose grilled options, which are lower in calories. However, there is an important limitation. Calorie counting focuses mainly on quantity, not necessarily on quality. Patient may reduce calories but still consume unhealthy foods. So while it is effective for weight loss, it does not always guarantee optimal nutrition. Now, let us move to meal replacement. Meal replacement involves substituting one or more meals with controlled portions of specific food products, such as shakes or nutrition bars. These are designed to be low in calories but still contain essential nutrients. For example, a patient may replace breakfast with a meal replacement shake instead of eating a high-calorie meal. This approach is useful for patients who have difficulty controlling portions or those who prefer structured eating plans. However, like any approach, it has limitations. It may not teach long-term eating habits, and patients may return to previous patterns once they stop using meal replacements. So again, sustainability is key. These methods can be helpful tools, but they must be combined with proper education and behavior change. Now, let us move beyond diet alone and look at other important components of obesity management. First, physical activity. Physical activity increases energy expenditure. This means the body burns more calories, and this helps create the calorie deficit needed for weight loss. But the benefits of physical activity go beyond weight loss. It improves cardiovascular health, increases muscle strength, and enhances overall well-being. It also reduces the risk of diseases such as diabetes, cardiovascular disease, and even some cancers. For example, regular walking, cycling, or resistance training can significantly improve health outcomes. Now, as physical therapists, this is our primary role. We design safe and effective exercise programs based on the patient's condition and ability. Now, let us talk about behavioral therapy. Behavioral therapy focuses on changing habits and modifying behavior related to eating and activity. Because obesity is not just a physical issue, it is also behavioral. For example, patients may eat while watching television, skip meals and then overeat later, or eat due to stress or emotions. Behavioral strategies include setting realistic goals, planning meals, eating at regular times, and identifying triggers for overeating. Another example is mindful eating. This means eating slowly, paying attention to hunger and fullness, and avoiding distractions while eating. Patients may also keep a food diary to track their eating habits. This increases awareness and helps identify patterns. So, the key message here is this: effective weight management requires a combination of diet, physical activity, and behavioral change. Not just one, but all three working together. The next major condition is diabetes mellitus. Diabetes mellitus is a group of metabolic disorders characterized by hyperglycemia or high blood sugar levels. This occurs due to problems with insulin. Either the body does not produce enough insulin, or the body cannot use insulin effectively. Now, why is this important? Because insulin is responsible for regulating blood glucose levels. When insulin function is impaired, glucose accumulates in the blood. Over time, this leads to damage in various organs. These include the eyes, kidneys, nerves, heart, and blood vessels. Now, let us look at the types of diabetes. First, type 1 diabetes. This occurs when the body destroys the insulin-producing cells in the pancreas. As a result, there is little to no insulin production. Patients with type 1 diabetes require insulin therapy. Second, type 2 diabetes. This is the most common type. It involves insulin resistance, meaning the body does not respond properly to insulin. It is strongly associated with obesity, physical inactivity, and poor diet. Third, gestational diabetes. This occurs during pregnancy. It increases the risk of complications and may also increase the risk of developing type 2 diabetes later in life. So, understanding these types helps us identify risk factors and guide management. Now, let us discuss how diabetes is diagnosed. The slide shows the criteria based on the American Diabetes Association. There are 4 main diagnostic methods. Each test has a specific purpose and gives us different information about blood sugar levels. First, HbA1c test. A value of 6.5% or higher indicates diabetes. Now, what does this test measure? HbA1c reflects the average blood glucose level over the past 2 to 3 months. It works by measuring how much glucose is attached to hemoglobin, which is the protein in red blood cells that carries oxygen. So instead of showing just a single reading, this test gives us a long-term picture of blood sugar control. That is why it is very useful for both diagnosis and monitoring. Second, fasting plasma glucose. A level of 126 milligrams per deciliter or higher indicates diabetes. This test measures blood sugar after at least 8 hours of fasting. So the patient does not eat overnight, and blood is drawn in the morning. Purpose of this test is to assess the body's baseline glucose level without the influence of recent food intake. It helps us determine how well the body regulates glucose at rest. Third, oral glucose tolerance test. A value of 200 milligrams per deciliter or higher 2 hours after glucose intake indicates diabetes. In this test, the patient drinks a glucose solution and blood sugar is measured after 2 hours. Purpose of this test is to evaluate how well the body processes sugar. It shows how efficiently insulin works after a glucose load. This is especially useful in detecting early problems in glucose metabolism, such as prediabetes or gestational diabetes. Fourth, random blood sugar test. A value of 200 milligrams per deciliter or higher, along with symptoms, indicates diabetes. This test can be done at any time of the day, regardless of when the patient last ate. Its purpose is to quickly assess blood glucose levels, especially in patients who already have symptoms. Now, let us review the common symptoms. These include frequent urination, excessive thirst, and unexplained weight loss. These occur because high blood sugar affects fluid balance and energy utilization in the body. Now, why is early diagnosis important? Because uncontrolled diabetes can lead to serious complications such as nerve damage, kidney failure, and cardiovascular disease. As physical therapists, we may encounter patients who are undiagnosed or poorly controlled. So recognizing signs and risk factors is very important, because early referral and timely intervention can prevent long-term complications. As physical therapists, we need to know how to interpret the diagnostic values and understand the difference between normal prediabetes and diabetes. This table summarizes the cutoff values for each category. Let us begin with normal values. For HbA1c, a value below 5.7% is considered normal. For fasting blood glucose, 99 mg per deciliter or below is normal. For glucose tolerance, 140 mg per deciliter or below after 2 hours is also normal. Now let us move to prediabetes. This is a very important stage. Prediabetes means that blood sugar levels are higher than normal, but not yet high enough to be classified as diabetes. For HbA1c, this is between 5.7 to 6.4%. For fasting glucose, 100 to 125 mg per deciliter. For glucose tolerance, 140 to 199 mg per deciliter. Now, why is prediabetes important? Because this stage is reversible. With proper lifestyle changes such as diet and exercise, patients can prevent progression to diabetes. Now, diabetes. For HbA1c, 6.5% or higher. For fasting glucose, 126 mg per deciliter or higher. For glucose tolerance, 200 mg per deciliter or higher. So this table helps us quickly identify the patient's status. As clinicians, this allows us to intervene early and guide patients appropriately, because early detection leads to better outcomes. Let us discuss the goals of nutrition therapy for diabetes. The first goal is to reduce the risk of developing diabetes or prevent its progression. This is achieved through healthy eating, physical activity, and maintaining a healthy body weight. Now, for patients who already have diabetes, the goal is to achieve and maintain normal levels of blood glucose, blood pressure, and lipid profile. Why are these important? Because uncontrolled levels increase the risk of complications. Another key goal is to prevent or slow the development of complications. This includes complications affecting the eyes, kidneys, nerves, and heart. This is done through proper diet and lifestyle modification. Now, an important point: patients should still enjoy eating. Diet therapy should not feel like punishment. It should be sustainable and adapted to the patient's preferences. So the key message is: control the disease while maintaining quality of life. For type 1 diabetes, there are currently no specific nutrition recommendations for prevention. However, for type 2 diabetes, prevention is very possible. One key recommendation is increasing dietary fiber intake. The suggested intake is about 22 to 35 grams per day. Fiber helps slow down the absorption of sugar, which improves blood glucose control. Sources of fiber include whole grains, vegetables, fruits, and legumes. Another important strategy is regular physical activity. Exercise improves insulin sensitivity, meaning the body can use glucose more effectively. Finally, lifestyle changes. This includes maintaining a healthy weight and adopting a balanced diet. So prevention is not complicated. It is based on consistent healthy habits. And these habits can significantly reduce the risk of developing diabetes. Now, let us talk about controlling diabetes through diet. First, carbohydrates. Carbohydrate intake has the greatest impact on blood sugar levels. So monitoring carbohydrate intake is a key strategy. This does not mean eliminating carbohydrates. Instead, we focus on quality and quantity. Patients should be encouraged to eat high-fiber carbohydrates such as whole grains, vegetables, and legumes. At the same time, they should reduce intake of sugar, refined carbohydrates, and sugary drinks. Now, fats. Fat intake also plays a role, especially in cardiovascular health. Patients should limit saturated fat to less than 7% of total calories. They should also avoid trans fats. Instead, encourage healthy fats, such as those found in fish, nuts, and plant oils. Another recommendation is to consume fish at least twice a week. 'Cause fish contains omega-3 fatty acids, which are beneficial for heart health. So the key idea is control carbohydrates and improve fat quality. Protein should make up about 15 to 20% of total daily calorie intake. Now, here is an interesting point. Protein can stimulate insulin release, but it does not significantly increase blood glucose levels. So, protein is important, but it should not be used to treat low blood sugar. It is also not recommended as the main strategy for weight loss. Now, alcohol. Alcohol should be consumed in moderation. On its own, alcohol does not immediately raise blood sugar. However, when combined with carbohydrate intake, it can increase blood glucose levels. Also, excessive alcohol intake can lead to complications, including liver damage and poor glucose control. So, moderation is very important. As clinicians, we guide patients to make safe and informed choices. Now, let us move to osteoarthritis. Osteoarthritis is a chronic degenerative joint disease. It involves the breakdown of cartilage and results in joint pain, stiffness, and reduced mobility. Commonly affects weight-bearing joints such as the knees, hips, and spine. Now, what causes osteoarthritis? One major factor is joint overuse. Over time, repeated stress leads to cartilage damage. Now, medical management depends on the patient's condition. Non-pharmacological treatment is very important. This includes exercise, particularly range of motion and low-impact aerobic exercises. Examples include walking, cycling, and swimming. Surgery may be considered if the condition does not respond to conservative management. So, osteoarthritis management involves both medical and lifestyle interventions. Now, let us focus on nutrition therapy for osteoarthritis. One of the most important factors is body weight. Excess weight places additional stress on weight-bearing joints. So, weight management is a key strategy. Even small weight loss can significantly reduce joint pain. Now, a well-balanced diet is recommended. This should follow general dietary guidelines while promoting a healthy body weight. Now, let us look at specific nutrients. Vitamin B6 may help reduce inflammation. Folate and vitamin B12 support tissue repair. Antioxidants help protect cells from damage. There are also complementary therapies. These include glucosamine and chondroitin sulfate. These are naturally occurring substances found in connective tissues. They may help support joint health. However, results may vary and they should be used with proper guidance. So overall, nutrition supports joint health and complements physical therapy interventions. Gout is a metabolic disorder that involves a problem in purine metabolism. Purines are natural substances found in many foods, and they are also produced by the body. When purines are broken down, they form uric acid as a waste product. Under normal conditions, uric acid is dissolved in the blood and excreted through the kidneys. However, in gout, there is either too much uric acid being produced or not enough being eliminated. As a result, uric acid accumulates in the bloodstream. When levels become excessively high, this leads to the formation of urate crystals. These crystals are sharp, and they deposit in the joints and surrounding tissues. This is what causes the characteristic symptoms of gout. One of the most common presentations is a sudden onset of severe joint pain. This is often described as intense, throbbing, or stabbing pain. It usually affects the big toe, but it can also involve other joints such as the ankles, knees, and fingers. The affected joint may become red, swollen, warm, and extremely tender to touch. Even light contact, such as a bed sheet, can cause significant discomfort. These episodes are called acute gout attacks. They often occur suddenly, sometimes at night, and can last for several days. Now, over time, if gout is not properly managed, repeated attacks can lead to chronic joint damage. There may also be the formation of tophi, which are visible deposits of uric acid crystals in soft tissues. In addition, excess uric acid can accumulate in the kidneys, leading to kidney stones. So gout is not just a joint condition, it can also affect other systems in the body. In terms of medical management, treatment focuses on reducing inflammation and controlling uric acid levels. During acute attacks, medications such as colchicine and nonsteroidal anti-inflammatory drugs or NSAIDs are commonly used. These help relieve pain and reduce inflammation in the affected joint. For long-term management, other medications may be used to lower uric acid levels. Now, an important aspect of gout is its strong association with diet and lifestyle. Certain foods are high in purines and can increase uric acid production. Examples include organ meats, such as liver and kidney, as well as certain seafood like sardines and anchovies. Alcohol, especially beer, also increases uric acid levels and reduces its excretion. In addition, large meals and excessive intake of rich foods can trigger gout attacks. So, dietary habits play a significant role in both the development and management of gout. This is why nutrition therapy is a key component of treatment. As healthcare providers, it is important to educate patients about these dietary triggers. Because with proper lifestyle modification, the frequency and severity of gout attacks can be significantly reduced. This slide classifies foods based on their purine content, which is very important in the dietary management of gout. As mentioned earlier, purines are substances that break down into uric acid. So the more purines a person consumes, the higher the uric acid levels in the body. This slide divides foods into 3 categories: high purine, moderate purine, and low purine. Let us begin with high purine foods. These contain more than 500 milligrams per 100 grams and should generally be avoided. This applies both during acute gout attacks and even during remission to prevent recurrence. Examples include organ meats such as liver, heart, kidney, and brain. These are very high in purines and can significantly increase uric acid levels. Certain fish, such as anchovies, sardines, herring, and mackerel, are also included in this group. Other items include broth, gravy, and bouillon because purines can be concentrated in these preparations. Goose meat is also high in purines. And importantly, alcohol, especially beer, is a major trigger for gout attacks. So the key message here is, these foods should be avoided as much as possible. Now let us move to moderate purine foods. These contain about 100 to 400 milligrams per 100 grams. Unlike high purine foods, these are not completely restricted, but they must be consumed in limited amounts. The guideline suggests 1 serving per day, which is about 2 to 3 ounces of meat or fish or half a cup of vegetables from this group. Examples include fish, poultry, and meat. Also included are some vegetables such as asparagus, beans, lentils, mushrooms, dried peas, and spinach. Now, an important point, even though some vegetables are in the moderate group, they are generally less likely to trigger gout compared to animal sources. So restriction is more focused on animal-based purines. Now, let us move to low purine foods. These contain less than 10 milligrams per 100 grams and are considered safe for daily consumption. These foods form the foundation of a gout-friendly diet. Examples include bread, cereals, and other grain products. Also included are butter and margarine, although these should still be consumed in moderation due to fat content. Other examples include cakes and cookies, chocolate, coffee, condiments, cornbread, cream, and eggs. Now, while these foods are low in purines, it does not mean they are all healthy in large amounts. For example, cakes and cookies are low in purines but high in sugar and fat. So balance is still important. Now, let us summarize the key idea. High purine foods, avoid. Moderate purine foods, limit. Low purine foods can be consumed regularly. As clinicians, this classification helps us give clear and practical advice to patients. Instead of giving vague instructions, we can guide them on exactly what to eat, what to limit, and what to avoid. Because proper dietary choices can significantly reduce the frequency of gout attacks and improve quality of life. Nutrition therapy plays a central role in the management of gout. Because unlike some conditions, gout is highly influenced by what the patient eats and drinks. So proper dietary modification can significantly reduce the frequency of attacks and improve long-term outcomes. One of the first recommendations is to limit or avoid foods that are high in purines. As discussed in the previous slide, these include organ meats, certain seafood, and alcohol, especially beer. These foods increase uric acid production and can trigger acute gout attacks. The next recommendation is to restrict total purine intake to about 100 to 150 milligrams per day. This provides a clear guideline for patients and helps control uric acid levels more effectively. Now, let us talk about fluid intake. Patients with gout are encouraged to increase their fluid intake to about 3 liters per day. Why is this important? Because water helps dilute uric acid in the blood and promotes its excretion through the kidneys. This also reduces the risk of kidney stone formation, which is a common complication of gout. A simple example would be encouraging patients to drink water regularly throughout the day instead of sugary drinks or alcohol. Now, let us discuss macronutrient distribution. Urate excretion is influenced by the type of nutrients consumed. Carbohydrates actually help increase the excretion of uric acid. So the diet should be relatively high in carbohydrates, about 50 to 55% of total daily calories. These carbohydrates should come from healthy sources such as whole grains, fruits, and vegetables. Now, fats. High fat intake can reduce uric acid excretion. So the diet should be low in fat, about 30% of total daily calories. This also helps reduce cardiovascular risk, which is often associated with gout. Now, protein. Protein intake should be moderate. Not too high and not too low. Excess protein, especially from animal sources, can increase purine intake. So patients are encouraged to choose healthier protein sources such as plant-based proteins and low-fat dairy. Now, let us put this into a simple clinical example. If a patient with gout typically eats fried meat, drinks beer regularly, and consumes very little water, they are at high risk of recurrent gout attacks. So our intervention would be reduce intake of high purine foods, increase water intake, shift to a balanced diet with more carbohydrates, and limit fat intake. So overall, the goal of nutrition therapy in gout is to reduce uric acid levels, prevent acute attacks, and improve overall health. Because with proper dietary management, gout can be effectively controlled. To summarize everything we have discussed, a healthy diet should be balanced, nutrient-dense, and followed throughout the lifespan. The most of the diet, about 85%, should come from healthy food choices while allowing some flexibility. At the same time, we must limit sugar, saturated fat, sodium, and alcohol. Now, in clinical practice, nutrition therapy becomes more specific. It is individualized based on the patient's condition and includes both assessment and intervention. Nutrition plays a major role in healing, recovery, and overall outcomes. We also discussed key conditions: obesity, which requires proper calorie balance; diabetes, which focuses on blood sugar control; osteoarthritis, where weight management is important; and gout, which requires limiting purine intake and increasing hydration. Finally, as future physical therapists, your role is not to prescribe detailed diets, but to recognize unhealthy habits, provide basic guidance, and support lifestyle changes. And when needed, refer patients to the appropriate specialists. Because in the end, exercise combined with proper nutrition leads to better patient outcomes. That brings us to the end of our discussion on dietary guidelines and nutrition therapy. I hope this lecture helped you understand that nutrition is not separate from physical therapy, but is an essential part of patient care. As future clinicians, always remember that what your patients eat affects how they heal, recover, and function. So even with simple knowledge, you can already make a significant impact on patient outcomes. Before we end, I would like to give an important announcement. When classes resume, there will be a long quiz covering this topic. So I strongly encourage you to review your notes, understand the concepts, and not just memorize but be able to apply them. Thank you, and I'll see you in our next session.